Why would it make sense to apply the Buteyko method for asthma? Well, it can really help your asthma condition and alleviate your symptoms of coughing, wheezing, breathlessness, chest tightness, exercise-induced bronchoconstriction, and even frequent colds and chest infections. The nose is there for a reason, and it's filtering, moistening, warming the incoming air. You also harness nasal nitric oxide by breathing through your nose, and nitric oxide is a natural bronchodilator. Now, it is fairly common that when we have asthma, that inflammation in the lungs will travel up to the nose. Our nose is stuffy. We feel we're not getting enough air through the nose. We open our mouth. We're taking cold, dry, unfiltered air directly into the lungs, and this is going to cause and contribute to airway narrowing. So the first step for somebody with asthma is learn how to decongest your nose, and that can be very easily done using the Buteyko method. The exercise is taking a normal breath in and out through your nose, pinching your nose and holding your nose, just gently nodding your head up and down, holding your breath, maybe to a count of about 10 nods or so. Then let go and breathe in through your nose. Now, the more you breathe through your nose, the better it works. In terms of helping to open up the lower airways, practicing the Buteyko method in clinical trials, and you can check out, say, for example, the first clinical trial of the Buteyko method in the Western world was 1994 at the Mater Hospital in Brisbane. Results showed that after 12 weeks, the group which were practicing the Buteyko method had 70% less symptoms, 90% less need for rescue medication, and 49% less need for inhaled corticosteroid. Now, the interesting thing was that prior to the study, the group, both in the control group and in the Buteyko group, were breathing 14 litres of air per minute. It's too much air. So these individuals are breathing too hard and too fast, and as a result, the volume of air that they bring into their body is too much, and this is feeding into their asthma symptoms. Now, you might say that this is normal, and yes, one could argue it is, because with asthma, we feel a narrowing of the airways. We're not getting enough air. And in response to that sensation of air hunger, we typically breathe faster and harder. But the problem with that faster and harder breathing is that it can aggravate the airways further. So it's a vicious circle. And this is very important then to target breathing, because the problem is, after all, breathing. So why not improve underlying breathing patterns to help open up the airways? And we can do that because nitric oxide helps open up airways and carbon dioxide helps open up airways. So when you practice the Buteyko method, the objective is to help normalize the partial pressure of carbon dioxide in the blood. And this in turn then can help to serve as a bronchodilator, in other words, opening up the airways of people with asthma. You will know by your controlled pause how well you breathe, and if you measure your controlled pause and your result is less than 25 seconds, there's significant room for improvement. Now, it is normal for people with asthma to have a low breath hold time. So practice Buteyko, improve your controlled pause, and see the results that you can get for your asthma.